Hey everyone, how you doing? I hope you're well. Today I want to talk about all-on-4 versus what I call a complex restorative treatment plan. Okay, so there's two options that a lot of people who come to see me have, and there's one option which they think that they need. So let's go through that in a bit more detail now. The first thing you might notice, the regular viewers may notice, is we've got different surroundings here. Okay, and that's because I've recently moved into my own premises. We've got a lovely premises, very spacious, and just a nice place to see the patients who we see for this complex kind of stuff. Okay, and that's why I haven't actually uploaded anything for a long time. I've just been so crazy busy with this place. Now, when somebody gets in touch with us and they say, look, I'd like to explore my options in terms of all-on-4 or replacing a full set of teeth with dental implants, we say, okay, that's cool. Come in, let's have a conversation. Let's see what your situation and let's see where you are with things. And I would say almost 50% of the patients who think they need to have everything taken out and have implants and then a full set of teeth on implants, 50% go for something else. They go for what we call a complex restorative treatment plan. Okay, and that's really a combination of crowns, bridges, veneers, implants, and these are all tools that we use to rebuild a full smile. Okay, whereas all-on-4 is effectively just one tool. So we use a whole combination, but there are advantages and disadvantages to each treatment plan. Okay, and that's what I want to go through with you today. So when we see patients for consultations, they fall typically into three categories. The category number one is absolutely, definitely need all-on-4 treatment, okay? Or that would be the best treatment in their situation. All their teeth are loose or they've all broken down at gum level. There's so few teeth which are worth holding on to that it makes sense to remove everything and start again. The opposite end of the scale, this doesn't happen too often, but it did happen a few years ago, and literally my nurse saw the x-ray and she before I saw the patient, and she was like, this isn't an all-on-4 case, this is veneers. Okay, so the perception of this person's smile was so bad that he felt that he needed to have everything taken out, but actually we just replaced 2 missing teeth with dental implants and the rest was porcelain restorations, and we gave him a fantastic smile, exactly what he was looking for. And there are a million advantages to doing this, because in his situation, keeping all of his own teeth, just resurfacing them, making them look nicer, is by far the best solution. His teeth are way better than any implants that I could ever give him. But there's this massive gray area in the middle, okay? And this gray area, I honestly don't know what the best solution would be. So in these situations, we have a detailed conversations between me and my patients, and we talk through the pros and cons of the different options which we've got. And the right treatment plan really boils down to what my patient feels is the right plan after being given all of the information. Okay, I very rarely say, look, you should definitely have this or you should definitely have this. Okay, in a vast majority of cases, there are options, and with enough education, our patients can just choose which option is the best for them. And if you see a dentist and they kind of pushing you towards a certain treatment, maybe get different opinions, because really there's different ways to approach a situation. But they may have asked a number of questions. For example, if a patient comes in and they've got teeth which are completely hopeless and they say they absolutely want a fixed set of teeth, then you're very limited in options. It is really all-on-4. So then we don't have a choice. But if they're looking for a variety of options to replace a full set of teeth, then we've got dentures on mini implants, we've got dentures on normal clip-in denture teeth, we've got all-on-4s. We've got all of these treatments to our disposal, and it's all about asking the right questions, figuring out what our aims and objectives are, and therefore guiding our patient to make the right decision based on all of that information. But I know that all-on-4 sounds really appealing, okay, because we know that dental problems start really early on and they progress at a slow rate, but they keep progressing. So the people who come and see me, their teeth are usually in a really bad state. It's happened over a very long period of time. So something like all-on-4, which you can literally just click your fingers and suddenly make all these problems go away and have a fantastic set of teeth, is really, really appealing. But let's let's look at the other options which we've got as well. So the other option is complex restorative. You can see in this case, this is a photo after we've kept a whole bunch of teeth, we've placed our implants, okay, where we've got all these colored metal rods coming out, that's where the implants are, and you can see that the teeth we've kept, and you can see the amount of tooth reduction that we've done to these teeth, because these teeth have been prepared for either crowns or veneers or bridges, whatever the most appropriate treatment is in that particular situation. So for this video, I actually did a little bit of brainstorming, and I've got a whole list of the things that we're going to go through. Let's look at the number of appointments, okay? All-on-4 versus complex restorative. Typically, all-on-4 is going to involve less appointments than the more complicated, complex restorative options, okay? I've got a lady who I'm treating at the moment who we had to do bone grafts and sinus lifts for. We then leave that to heal for a period of time. Then we put our implants in. Then we rebuild on the implants, okay? All of these stages typically take time. Now, there are other situations where we don't need to do the grafting, or we can do the grafting at the same time as putting the implants in. And in those situations, there's not really a big time difference between an all-on-4 versus a complex restorative option. Because remember, with all-on-4, you still do what you got to do implants-wise. You do all the surgical stuff first. We let that heal then, 4 to 6 months, and then we start making the teeth on there. With the complex restorative, if you can get the implants in without doing much grafting, then you can do that. And in 3 to 6 months, we're ready to go ahead and put the final teeth on. Now, with all-on-4, you leave with really good looking temporaries straight away. And even with the complex restorative, we try our best that literally on the first appointment, our patient leaves with at least a visual improvement. Okay, and that's effectively creating this whole trial smile, making a smile in temporaries. I want every time they come in to see us, something gets a bit better every single time. Now, the amount of surgery can also be a differentiating factor. Okay, I've already mentioned this. With all-on-4, typically, we're looking at 1 surgical appointment. Okay, if we're doing top and bottom, we try and do it in 1 day. So all the surgery is done in 1 big hit, really. Okay, and some people have sedation for this, so they don't really remember it, and that's all great. With a complex restorative, it can be done in 1 go, or sometimes we need to do it in stages. Okay, it all depends on the situation. I would say in the vast majority of cases, we can do it in 1 go. Some people may prefer to do it in more stages just because it's smaller chunks. That way, some people prefer to get it all done in 1 go. Again, we're guided by our patients with regards to something like this. Something like all-on-4 is actually much easier for the clinician to treatment plan and execute, okay? Like I said, all-on-4 is really just 1 skill, okay? It's 1 surgical treatment. Whereas if we look at a complex restorative, we could be doing complex bone grafting, we could be doing sinus lifting, we may need to look at tissue grafting, we may need all these different kind of techniques. And then we've got the non-surgical stuff as well, okay? So the different types of crown preparations, veneer preparations, getting veneer teeth to match with implant teeth. So those people who exclusively all they do is implants are kind of limited in what we call the restorative stage. Now, you may get some people who work together, and that's absolutely fine. I work with restorative dentists. So what that means is some patients will go and see a restorative dentist, but that dentist doesn't do the surgical stuff. So then I will do all the surgical implants, but I only work with about 2 or 3 dentists with this kind of relationship, because I know that very few clinicians can actually treatment plan to the level that I can work with them. Okay, everybody needs to be thinking the same thing. And because I do all the restorative myself, I feel comfortable with people who work the same way. Okay, I'm not saying that we are the only teams around in the world who can do this, but when you are looking around, to look at all of these different options, ask about the implant dentist and how long have they been working together. Can I see cases where you guys have worked together and not done an all-on-4? What does the end smile look like? Because if they've got a good working relationship and they can achieve great results, chances are they can achieve great results for you as well. Now, one thing that I get asked on quite a lot, weirdly, is fake gum. Okay, so I've done videos in the past explaining the different type of full mouth implants where some have fake gum, some have patient's natural gum. And with a complex restorative option, we actually maintain more bone and more gum because we're keeping the teeth. As soon as you remove the teeth, the bone shrinks and it disappears. But with complex restorative, we're keeping the teeth in a lot of the situations. That helps us keep the bone, and it means that any bone grafts we do, hopefully they're not too complicated. Now, the consequence of this is where we do place our implants, even though we've lost a bit of bone in those situations, we can usually make the teeth without fake gum in those situations. Okay, so I think a lot of people like that. It's a more natural, it's a more lifelike appearance to everything, even if you pull all the cheeks and gums back. Some teeth may look a little bit longer than others, but the overall look is good and more of the natural gum is maintained. Now, with an all-on-4, it is possible in certain situations to maintain the gum, okay? And we call this an FP1. I've done a video on this in the past. And on that video, a lot of people commented, oh, if I was going to get this done, I would only have FP1. In my opinion, it's not a choice you can make. That's not something that, you know, it's like choosing from a menu. It's more about your individual situation, how much bone has already been lost. And if very little bone has been lost, say you lost your teeth through tooth decay rather than gum disease, then FP1 might be an option there. Okay, but it's not an option for everyone. Now, one thing I think has a massive bearing on which option you choose is the cost of it. The way we deal with the cost in our clinic is very different. I don't know anybody else who has this kind of pricing strategy because it doesn't actually work out too great for us, and I'll explain why in a second. If we're looking at an all-on-4, it's like buying a product almost, right? Everyone will do it slightly differently. Some people are more experienced than others, but it's a treatment where we know as a clinic what our costs are going to be, right? We know roughly how long the treatment's going to take. We know a number of appointments. So we can be pretty certain in the end cost to our patients. That's why you'll see costs freely advertised, okay? Most places, if they're using good quality materials, are in the region of about £15,000 per arch, okay? So if you're looking at double arch, it's double that. If we do what we call a complex restorative plan, on our computer system, I'll itemize everything. Okay, we're doing this number of veneers, we're doing a sinus lift on this side, this is a bone graft, all that kind of stuff. And more often, well, not more often, every single time, the cost of a complex treatment plan is far more than the cost of an all-on-4. I did one the other day and it came to like £46,000, okay? We've never charged £46,000. We actually say, look, it's going to cost the same. Whether you want us to do the complex restorative plan or an all-on-4, it's exactly the same. The reason that I say that is because I don't want my patients to make a long-term treatment decision based on the cost of the treatment. Okay, I don't want them to pull out a whole bunch of healthy teeth, have implants because it was a cheaper option to do. That's why the treatment plan that came to like £46,000, it was actually, we charge the same, so it was about 30. I think it was a little bit less for getting the same thing. Okay, so, you know, like I say, most dentists don't do something like this. Ask your dentist, you know, what the options are on this. The only reason that we can do this is because I do all of the treatment myself, okay? And we can do a lot of treatment in one session, so it saves us a bit of time in that sense. And yeah, we might not be so profitable on these things, but I don't care, right? My end goal is that my patients are happy. We've got the best treatment for them. We've taken them from a place of despair to a place where they absolutely love their smile, okay? I'm not counting the pennies on these things. So, you know, that's just my personal opinion on it. But if you are going to your dentist, and I know the vast majority of people are not local to us, so be prepared. There's going to be a big cost difference between the two options, but at least explore what that cost difference is and maybe it still works for you. All right. The next thing I've got on here is all-on-4 is a single surgical tool, whereas a complex restorative is multiple techniques, okay? And it may be that your practice is good at one thing and they don't really do many of the others, okay? Look at any of these all-on-4 factories that that are dotted in UK, abroad, everywhere, okay? It's one tool. That's all they offer. And they may or may not say that you're suitable. There's a massive financial incentive for them to have treatment taken up. So there's nothing wrong with going to them for all-on-4 when you absolutely need all-on-4, okay? I'm sure they'll do a fantastic job, but you may not have all of the options there, okay? So like I've said in loads of videos, get multiple options from different clinicians, different clinics, and find something that fits for you, okay? You're the customer, you're in control. Gone are the days where a dentist will be like, look, you need this, 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 and this, okay? It's more about the conversation. It's more about understanding your needs and finding a solution that will get you to where you want to go. Okay, and the last one I've got on here is with an all-on-4, you pretty much always lose all of your teeth. Okay, with a complex restorative option, you keep your teeth. And there's a number of benefits and slight disadvantages to this as well, because the advantage is the feeling and the proprioception. Proprioception is basically when your teeth bite together, you have a feeling that your teeth are biting together, and therefore the biting forces are a little bit more reasonable. With all-on-4, you've got implants against implants, and you will put more biting force on those implants. Now, these days we use zirconia teeth, so it's unlikely we're going to get problems with something like that. But a lot of people like the idea of having sensation in their teeth. Now, which is going to give you problems further down the line? Okay, so this is another big thing which a lot of my patients are thinking about, because if you're keeping some of your own teeth, it sounds like these teeth will give me problems further on. And it's possible that they do. Okay, so in a lot of situations, we've got teeth which have got big fillings and root canals, and the more work you do to a tooth, the weaker it actually gets. So on an x-ray, if we look at an x-ray and the tooth is mostly white, that tells us it's had loads of work done to it and there's very little of the natural tooth left. Compare that to a tooth which is healthy, hasn't had anything done, it's all grey. Okay, so just from a layman's point of view, if you're looking at your x-ray, the more white there is, the weaker the tooth is. So a lot of these teeth we actually keep, but they're not perfect. But we've had this discussion. So if in the future we get a problem with these teeth, at least it's a single tooth problem rather than another full mouth problem, because patients are usually finding us for a full mouth problem. We'll fix it all. We can't guarantee anything actually, but those teeth which have had so much work to them are a bit iffy. But if it was my tooth, I would give it a chance. I would hold on to it. Okay. And we make a promise for the patients who come and see us. If anything fails within a certain period of time, we'll just replace it free of charge. Okay. Because usually it's our decision to keep that tooth. Which is better? What's better, an all-on-4 or a complex restorative option? I would say it depends on you as a patient. Okay. It's all about educating yourself and finding out which options are available to you. Okay, not all options are available to everyone because of their own individual situation. It may be things in your medical history which are dictating a certain type of treatment plan. It may be the way that your teeth bite together. There's millions of variables involved. So if you see several dentists, okay, always ask to see before and afters. Okay, if they can confidently tell you the stories of the patients who they've seen, then chances are that they're experienced in what you're looking at. If those cases resonate with your individual situation, that's a really good sign. There's a lot of clinicians who know about this treatment, so they'll talk about it at a surface level. But after you've seen a few, you should be able to suss out those people who have more knowledge compared to others. Okay, and those people who've treated more cases because they've seen failures, they've seen complications as well. It also depends on your attitude to keeping your own teeth. Sometimes the whole sexy idea of an all-on-4 sounds amazing and you hate your smile so much, you think it's absolutely terminal. But the reality is those teeth could last you a really long time. Or maybe you've had gum disease, you've had loads of recession, and you could keep your teeth because there's enough bone to hold onto your teeth for another 10 years, but the amount of recession, you don't like it from a cosmetic point of view. So rather than looking at veneers to rebuild your smile, maybe where you would prefer the idea of an all-on-4. And also depends on age as well. Okay, I know I shouldn't really do this, but if you are older, it means whatever we do doesn't have to last as long. Okay, if you're having this treatment done in your 50s, we would think that, you know what, whatever we do needs to last another 50 years. What can we do when your natural teeth have only lasted about 40 years? Okay, assuming they start coming out age 10, they come out age 6. So we always try and think forward, okay? What's the next step? So if you're in your 50s, maybe it's worth considering more of a complex restorative option if that option is open to you, compared to, you know, just taking everything out, okay, and having implants. We've done it for people in their 40s, but that's because we literally had no choice in those situations. And I think cost is going to be a big factor for a lot of people, right? Even if that complex restorative option is available, the vast majority of places where you go to, I think the cost of that versus an all-on-4, there's going to be a big difference, okay? So just have an open and honest conversation, get quotes, you know, for both options. But remember, it's not just about the money. I know the money is really important, okay? But don't make a decision on the day. Sleep on it. Ask partners, families, whatever, whoever you want to get involved in it. Another question that I sometimes get is, okay, look, if I go for a complex restorative option, can I get all-on-4 later? Can we use the same implants and make an all-on-4? And the answer is complicated, as it is with all of these things. Usually, the people who get into the state of needing an all-on-4 are people who have completely lost all hope with the health of their teeth. If we do a complex restorative, we're going to take someone who is in that situation where they absolutely hate their smile, and we're going to take them to a position where they love looking in the mirror. It looks really nice. They may or may not get compliments. They usually do, but it's more about themselves. They feel good. They feel more confident. If you feel good and confident about your teeth, chances are you're going to take better care, okay, and see a hygienist regularly. And just being in control, taking good care will mean that everything will last longer, which means your chance of ever being in a situation where you need another full mouth restoration is kind of low. So it might be possible to convert a complex restorative option into a full arch implants option, but I think it would be rare for the reasons that I've mentioned. Anyway, guys, I'm sure this has turned out to be a fairly long video. I hope you enjoyed it. I hope you got something out of it, right? If you did, you know, please give it a thumbs up. If you've got questions and comments, you can put them down below, okay? I miss a lot of the YouTube comments, but if you find me on Instagram and you text me there, I'm a bit more likely to respond, or at least one of my team. All right, guys, I hope you have a fantastic day, and I hope that all the airplanes flying overhead didn't disrupt the audio too much. All right, guys, take care.